pharmacology, there are categories of medications that you're going to need to be familiar with. And there are certain types of medications that you're going to need to be familiar with. Diuretics are one. Know the common diuretics, know their dosing, and understand how they are affected in the body and the kidney and where the uptake is and so on. So you want to make sure that you understand that. Beta blockers are very important to know. ACE inhibitors, nitrates, CCB, digoxin is something, understanding what therapeutic digoxin levels are and any kind of parameters that you need prior to giving digoxin. Also statins and atropine, adenosine. So I would say the 3 A's, atropine, adenosine, and amiodarone. We're going to want to understand that, how we actually give that to the patient, how we administer those drugs to the patient, and then also what the expected side effects are. As for adenosine, you expect to see some type of block in the patient's EKG rhythm. So it wouldn't be a surprise if there was a question on the test that there was the EKG rhythm stopped or something like that for a short period of time, because that's an anticipated side effect of the adenosine, and understanding the reason why you give it and why that should occur. So those are some things that I always like to make sure that you're aware of. So during our time together, we're going to talk about I have a couple of case scenarios that I'd like us to walk through. And what I always like to encourage people to do is, when you're looking at pathophysiologies or disease diagnosis, you want to use the nursing process. The nursing process is something, when I was in nursing school, I really didn't. I don't want to say I didn't like it. I just really hated care plans. That was just kind of, oh my gosh, I have to do another care plan. Now after going through the extent of nursing school, I understand how important the care plan is, and understanding, and it gets you to think in that nursing mindset. And with that, with understanding how to use the nursing process, and with your assessment, understanding the diagnosis, the planning, what's needed, and the implementation and evaluation, it helps you to think in that methodical way so that things are not missed. You're able to get a full spectrum of what the disease or the pathology process is, and understand and how to take care of your client or your client population from a systemic perspective. Now, of course, the nursing process is not the same for all patients, because all patients are different, and just as our nursing care plans are. However, there is a standard that is consistent that you're going to want to understand. So when we look at the nursing process, and you want to look at content maps. So when we're looking at assessment, when we're looking at assessing our client, we're going to want to be, that's the phase where we're collecting the data. We are analyzing, understanding what the signs and symptoms are and everything like that, and taking a look at what it is that the patient is presenting with. So when we are looking at the diagnosis, we're trying to understand what the problem is. And then planning, diagnosis is the same as the planning, how to fix it. When you're planning your planning phase, with the diagnosis, it goes along with the pathophysiology. What is it that we have? What are the expected side effects? What does this patient's disease generally look like? Of course, no two patients are the same. They're all different. However, understanding then the NCLEX tests your knowledge of understanding what the basic is in that perspective. Implementation, how are we taking action? What it is that you're going to take action. And we'll talk about that as we go through a couple of case studies today, and then your evaluation process. This is a content map that we actually have and that you can download on our site for studying purposes.